Hey signers, welcome back to Learn How to Sign. Shout out to all of you working in the medical community. You have been asking and your video is finally here. Yay! This is also a great video for those not working in the medical field to expand your vocabulary. Now let's get started on learning how to sign medical signs. Before we get started, I want to talk to you about sign placement, specifically with the sign hurt. This is the general sign for hurt. But if you move it around, you can show that you have a stomach ache, a headache, a toothache, an earache, or anywhere else around your body that is hurting. So if you were to generally ask somebody if they were hurting, you would sign, "You hurt you?" So if you were wanting to ask about a specific place somebody is hurting, you would place it in that place with your eyebrows up, asking them, "Does it hurt here?" Now let's jump into medical signs. Medical or medic. You're doing a flat M hand right on your wrist to show somebody is taking a pulse. Medical or medic. Hospital, hospital. It's an H hand making the shape of a cross on your shoulder. Think of the Red Cross. Hospital. Doctor's office or doctor's office. You can do the sign doctor with a D or M for medical, and then office, like a room, but with O's. Doctor's office or doctor's office. Doctor or doctor. You do a D or an M hand on the wrist like you're checking the pulse. Doctor, doctor. Nurse, nurse. You're doing a flat N on your wrist to show a nurse checking the pulse. Nurse. Hurt, hurt. Now with hurt, you can move it anywhere on your body to show where there is an ache or a hurt. Hurt. Legs, legs. You're just using your index finger to reference to your legs. Legs. Feet, feet. You're just using your index fingers to point towards your feet. Feet. Head, head. Your dominant hand is moving from your forehead to your chin to show your head. Head. Eyes, eyes. You use your index finger to point to both of your eyes. Eyes. Ears, ears. You're just tugging at your ears. Ears. Nose, nose. You just point to your nose. Nose. Mouth, mouth. You just use your index finger to circle the mouth. Mouth. Sore throat, sore throat. You have a G-shaped hand and you're moving it up and down on your throat with a really sad face. Sore throat. Are you all right? Or are you okay? Your hand is slicing through your non-dominant hand, and your eyebrows are up because we're asking a question. Are you all right or okay? Feel, feel. Your middle finger, which is also called your feeler finger, is moving towards your chest in an upwards motion. Feel. Better or best. You have a flat hand moving up to a thumb right from your chin. Better or best? Okay. Okay. It's just O and K put together. Okay. Pow. Pow. This means that something has happened all of a sudden. Pow. Cold. Cold. You're constantly wiping your nose when you're sick. Cold. Cough. cough. And as you're signing this, make sure you do a with it. Cough. Dizzy. Dizzy. Your hands are moving around like the room is really dizzy and you're moving back and forth. Dizzy. Nauseous. Nauseous. It shows that your stomach is churning. Nauseous. Weak. Weak. These are your legs and they can't stand up on their own. Weak. Sweat. Sweat. This is showing the sweat dripping off your forehead. Sweat. Throw up or vomit. Your hands are coming out of your mouth like you're throwing up or vomiting something. Throw up or vomit. Fever. Fever. Your non-dominant hand is flipped backwards on your forehead like you're checking for a fever. Fever. Temperature. Temperature. Your non-dominant hand is the thermometer, and your dominant hand is moving up and down to show the temperature. Temperature. High. High. You have an H hand moving upward. High. Low. Low. Your hand is moving down lower to the ground. Low. Blood pressure. Blood pressure. It's showing the blood pressure monitor on the arm. Blood pressure. Blood. Blood. It's the sign red and blood is dripping down. Blood. Broken, break, or broke. This is something that is together that is now breaking apart. Broken, break, or broke. Sprain. Sprain. You're doing S hands towards each other and twisting them for a sprain. Sprain. Heal. Heal. It's showing that your muscles are improving or getting better. Heal. Sneeze. Sneeze. You're bringing your index finger to your nose and acting like you're sneezing. Sneeze. Allergies or allergic. You point to your nose and do the sign opposite. Allergies or allergic. Medicine. Medicine. You're shaking the middle finger of your dominant hand in your palm, showing like you're holding medicine. Medicine. Vaccine or shot. You're pushing in with your fingers like your thumb is giving the vaccine or the shot. Vaccine or shot. Pregnant. Pregnant. Your hand is moving out from your belly, but make sure you don't do it sideways and do this with it, because that would mean fat. Pregnant. Water. Water. It's a W hand right towards your lips. Water. Surgery. Surgery. The sign for surgery can be placed anywhere on the body for what kind of surgery it is. Surgery. To have your tonsils removed. This is representing the tonsils getting taken out of your mouth. To get your tonsils removed. Now let's put these signs into sentences. Where does it hurt? Hurt where? Are you allergic to any medications? You, medicine, allergies, you? The doctor will be here soon. Soon, doctor, arrive. Are you experiencing any dizziness? You experience dizziness, you? Awesome job! You did great! Practice these signs regularly so you can feel comfortable when you need to use these signs someday. Be sure to like, subscribe, and get notified so you don't miss any future lessons. And until next time, keep learning how to sign.